Friends, now I'll talk to you about fungal infections. Fungi lives everywhere, on plants, soil, and even on our skin. Mostly they don't cause any problem unless they multiply faster than normal or penetrate our skin through a cut. Although there are millions of species of fungi, about 300 of them can infect humans. Common 6 fungal diseases that can be treated with caution are yeast infection, athlete's foot, that is ringworm in the other parts of the body, the feet, which is often at the toes or in between the toes. There is itching, skin appears scaly, dry or flaky, cracked or blistered. Then ringworm occurs on the torso and limbs. The main symptoms is a ring-shaped rash with slightly raised edges. This rash can spread and is often itching. Then jack itch. This is also a ringworm infection on the skin in the groin area and thighs, most common in men and adolescent boys. There is rash that may worsen with exercise or physical activity. Then fungal nail infection is there and sporotrichosis. Candidiasis or candida are yeasts that can be found on the skin, mucous membranes, and in the intestinal tract. The most common fungal diseases or fungal skin infections are ringworm of the body, which is actually caused by a fungus and not a worm. Ringworm of the scalp occurs too. Since fungi thrive in warm, moist conditions, fungal skin infections can often develop in sweaty or damp areas that don't get much airflow. Some examples include the feet, groin, and folds of the skin. Often these infections appear as a scaly rash or discoloration of the skin that is often itchy. These infections are uncomfortable but can be controlled and not much serious. Fungal infections spread through direct contact. Even if an infected person's clothes are touched, the person can get it. It is highly contagious. If not treated, it can spread and be more irritable. Fungus infects the mucous membranes also, as I said before. Example is the vaginal yeast infection and oral thrush. There are several risk factors that can be put up, and there are increased risk of getting a fungal skin infection, which include living in a warm and wet environment, sweating heavily, not keeping your skin clean and dry, sharing infected person's items, even bedding, wearing tight footwear and clothes that don't breathe well, coming in contact with animals that may have been infected by fungus, with weak immune system due to immunosuppressant drugs, cancer treatment, and even HIV. Many types of fungal infections usually improve in response to over-the-counter medications. But see the doctor if a fungal infection doesn't improve but gets worse or returns back. Second, notice patches of hair loss along with itchiness of or scaly skin. Then have a person who has a weak immune system and suspect a fungal infection. Do see a doctor. Then have diabetes and you think you have a fungal infection. Then again see a doctor. Now about the treatment. Antifungal medications work to treat fungal infections. They can either kill the fungus directly or prevent it from spreading. Antifungal drugs are available over the counter treatments or prescription medications and come in a variety of forms like creams or ointments, pills, powders, sprays, and shampoos. Home remedies are keeping the affected area clean and dry, wearing loose fitting clothing and shoes that allow your skin to breathe. If over the counter medicines don't work, then do see the doctor. The doctor will examine you properly and give you correct exact medications. Then prevention of fungal infection. Practice good hygiene. Don't share things with an infected person. Wear clean clothes every day, particularly socks and underwear. Use breathable clothes and shoes. Avoid too tight clothes and shoes. Dry yourself after bathing, swimming, etc. Wear sandals and flip flops in locker rooms instead of walking barefoot. Wear, wipe gym equipments thoroughly before you use them or any other shared items. Stay away from animals that have signs of fungal infections such as missing fur or frequent scratching. Friends, if you like my channel, do like, share, comment about what I have said, and subscribe to my channel. Thanks for watching. Lots of love to you all, and bye for now.